Hi everyone, this is Dr. David Lee at Physical Therapy and Balance Center in Germantown. As some of you may know, but most don't, October is Physical Therapy Month. So as part of our push to let people know, we wanted to do a series of videos on some quick hitting exercises or stretches for very common problems. There's no more common problem than low back pain. And many of you may be experiencing it because you're working on the computer at home, probably not in ideal chairs. Most people have some sort of low back pain in their lifetime. So this is for those of you who have specifically just low back pain, not anything that shoots down the leg. If you have things like foot drop where you can't raise your foot up, or you have numbness tingling down the leg, this is not for you. For those conditions, you should see your doctor and you should get an orthopedic workup. This is for people who have just non-specific low back pain, meaning it's just diffuse across the back and it's achy, it may just hurt a little bit. This exercise is a great one for you. We prescribe this oftentimes in the office, and I'm going to have Teresa demonstrate with us. What we call it is a prone press up, but if you know yoga, they call it a cobra stretch. But a prone press up simply is you're lying flat on your stomach. You want your hands directly under your shoulder, and you want to press up. So go ahead, Teresa, press up, pushing through your elbow. And ideally, you keep your pelvis down. Okay, your pelvis stays down, and we're just arching through the low back. If you come up to the point where your pelvis or hips are coming off the table or the floor, you've gone too far. So you want to stop a little bit short of that and come back down, Teresa. And I recommend a series of these of about 10 reps. So go ahead, Teresa, go a few of those for us. Good, and then just back. Now, if you have a right-sided pain, you want to turn the right leg out by bending the knee and turning the hip out and pressing up through that. You won't be able to go as far, that's okay, just go as far as you can. That's gonna bias or hit the right side. Same thinking, if you go to the left, you're just gonna turn the left leg out. If your pain is on the left side, if you have low back pain specific to the left, press up with the left leg turned out. Perfect. And again, you won't go as far as if you had both legs straight. So you can target the right or target the left by turning the legs out. If it's across the low back, just keep the legs straight and go up and down. I recommend doing about a series of 10 repetitions, 10 reps. Try them 2 or 3 times a day. It's a great reset from when you're sitting all day working on your computer, or if you're in the car for a while and you get out, it's a great exercise for non-specific low back pain. So I hope this helps, and we'll be coming out with more of these as the month progresses.